What's up, everybody? How are you? Happy Monday. It is April already, and time is flying. It is not waiting for anybody, and that's okay. I mean, what they say, April showers bringing May flowers. We just had the whole solar eclipse thing. Uh, Congratulations to South Carolina, Dawn Staley, and her team doing their thing, going undefeated. That was an exciting game. I don't know if anybody saw that.
Woo! Yes, it was.
Yes, exactly. Tonight we have the men doing their thing. We'll find out who's going for whom. Who's
Hmm.
um, my Yankees are on the roll, so I'm excited about that. Knicks, Julius Randle, we understand he's hurt, but we're gonna persevere. Otherwise than that, we got the NFL draft coming up soon. So there's so much going on, and this is Real Talk with Dr. Marilyn Quarter tonight. This is the doctor's corner, baby. Um, I'm happy about always doing that. And let me ask the doc, how are you doing today?
I am fine, and I am so, um, how should I say? I'm honored to be on Real Talk, and I have
Mhm.
some valuable information so that we can make sure that we stay healthy, that we stay aware of what is in store and what's coming down the pipe in terms of health issues.
Absolutely. Well, tonight, Doc, you take it away. Is there anything that you want to talk about? And we're just going to go. Everybody, if you have questions or comments after the doc says what she says, or in lieu of the topic that she is discussing, please ask them and type them in. I will show them. And let's get it going. So go ahead, Doc.
Okay, hello, hello, and it is April, and we saw the eclipse. We had our special glasses on. We don't want
Yeah.
to blind anybody, so hopefully you
No.
did as well. And yeah, I'm so excited with South Carolina. Dawn Staley, hello, hello. She
Yeah.
kept it real. She gave thanks to Lord because I'm telling you, that other team, that person on that other team was trying to get through, but they shut her out. They shut her out.
Yeah.
So I'm just gonna go
Yeah.
from there.
They did
So
some good.
yes. So folks, here's what I need to say to everyone. Interestingly, medicine comes back. I call it 360. It comes back around. And we're
Mhm.
beginning to see that. And we're beginning to see it in I call it a blind way. When I say a blind way, I'm talking about tuberculosis, TB. Now, people
Mm.
over the years, somebody cough, oh, you got TB. And it was always a joking matter. It was always
Yeah.
something that, you never took seriously. But folks, please, it is the number one infectious disease that causes death in the world globally. Pay attention. People don't even realize that. Folks will say, "Oh, nobody gonna get TB." That was old diagnosis. It used to be called an old infection. It used to be called consumption, and it really totally consumed you. We had TB hospitals. We had wards that you would go on if you had TB. Because how is it spread? Coughing.
Mm-hmm.
It's called respiratory droplets. So you can sneeze, you can cough. Some people say you could be in a choir, somebody singing next to you and give you TB. TB.
Mm.
Yes, pay attention. Not to mention it is a sexually transmitted disease because guess what? We what? Share bodily fluids. Your saliva
Right.
is a bodily fluid. So I tell folks, sure, sexually transmitted disease, we think about gonorrhea, chlamydia, HIV, but so is tuberculosis. So let me back all the way up. Tuberculosis has been around for centuries. You'll hear about it even in the Bible when they have excavated, when they've seen old skeletons, they see where they had tuberculosis because you can even see it in your bones. So
Mm-hmm.
why
Mm-hmm.
is it that we don't really give it its just due? And that's because there's something called a TB test, a skin test. Years ago we put the little thing up under your arm. We call it a little bubble. It's called a
Right, right,
TB
right.
skin test. We're not giving you TB. What we're doing is seeing what we call a reaction to that purified type of material that if you've been exposed to TB. Now, it's two different things, exposure and having it. So pay attention. I'm talking the exposure first. If you've been exposed and we put that little bubble under your skin and we tell you don't bother it, don't scratch it, don't this, don't that, and we look at it in 2 days or 3 days. Us as physicians, we must get tested every year to be on staff at the hospital. And not only do we have to get tested, we got to come back in to show our arm, and to make sure that we call it reading the PPD. So you'll hear
Mhm.
folks when they go away to college or get a new job, they talk about testing for TB. But we take it too lightly. And I'm going to tell you why. I got 4 points to make. Being exposed to tuberculosis does not mean you have TB. Let me say it 3 times. Exposure is not the death sentence. Exposure means you've been exposed. You're on the subway in New York or DC or wherever.
Yeah, yeah.
Your child, or your, I hate to say this, but an immigrant is now coming over your house to eat dinner, and they're from a place that has TB epidemics, okay, and large scale TB cases. They also could be not active TB, but been exposed. Likewise, you're exposed. So
Wow.
it's important, just because your doctor hasn't asked you, do you want a TB test? Go in and get one,
Mm,
unless you're living in a bubble.
mm.
Because I'm
Now,
going to tell you about the exposure, and then I'm going to tell you about the latent TB. Because when you're exposed, it's in your body. It stays in your body
mhm.
unless there's treatment. Unless not only do you get tested, but then you get treatment. Now there's some drawbacks to the treatment. Okay, the treatment works, but the problem is, and this is one of the reasons I don't do adult medicine a lot. The problem is when we see where you have a positive TB test. See, in medicine, the good word is negative, negative for this, negative for that. But when you have a positive TB test, we say, okay, Miss Jones, we see that you have a positive TB test. But Miss Jones is not coughing. She's not having night sweats. She's not losing weight. She's not failing to thrive. But she has a positive TB test, the skin test. So
Right.
we then say, Miss Jones, I don't know where you got it, because that's the first thing she's going to say. What do you mean? I feel fine. Yes, you will. What do you mean? I don't know anybody have TB. No, and you may never know how you got it. Between doctors and school teachers and police officers, people in the community, serving the community, we easily get it. Police officer, you throw somebody down who's homeless. You're doing your job, and then before you realize it, you've been exposed. But your body doesn't tell you you've been exposed. The test does. So the
Mm,
exposure, we then say, okay, here's the protocol. There's something called rifampin. There's something called INH, which is isoniazid. There's a 4 antibiotics that we put you on. You got TB, baby. there are four. There
yeah,
are
one
four
little
medic.
cough, right? Yeah, a
Okay,
little cough.
you better. We talked about COVID. We better think about TB. There are 4 medications that have shown CDC, tested, that can, how should I say, it can reverse TB. The problem again, if you put on medication, you have to take it. Now pay attention, from 4 to 6 months. Years ago it was 9 months. Now people don't take their medicine for 2 weeks. Pay
Mm,
attention. So we got non-compliance. They just not taking it. They're like, I feel all right. Oh, I forgot. And then they don't take it. They still got the bottle that's 2/3 full. So what does that do? Not only does that mean that that person's treatment is incomplete, but it sets that bacteria up to become resistant. Resistance is the problem. And what we now see in the field of medicine, TB resistance strand. So TB medication resistant strand. And the TB no longer will say, oh, well, that isoniazid, we now coming back stronger. We need what we call multi-dose, multi-medications. So you may have to take 2 or 3 during a period of time. So that's one of the drawbacks, because most people don't complete their treatment. As you get a test for TB and you're positive, you get a chest x-ray. Why is that? We want to make sure that that positive TB is not a long-term positive TB, years and years. So you get a chest x-ray, and that's
okay.
what we call an AP, anterior and posterior, because that's important. And once you're positive for TB, you're always going to be positive, but we're giving you the antibiotics, TB test. We're giving you the antibiotics to make sure that that test, as we saw it real time, we treated it for 4 to 6 months. After that, you get a chest x-ray every 5 years. So some people don't need to have a test every year because it's going to come up positive because you've been exposed. But we simmered it down by giving you the antibiotics for 4 to 6 months. And then we're going to be monitoring every 6 months. I mean, every 5 years for the chest x ray. I know I'm talking a lot and I'm talking to you, and I'm emphasizing it because people don't know that they're positive. They may not even go to the doctors. They may go to the doctors and the doctor may not even test them because they don't have a new job or they're not applying. It's not required. It is required. That's your right. And those are your lungs. Now, there's a skin TB test, but now we do the blood test. Part of the blood test, as we test for hemoglobin A1C and cholesterol and vitamin B and D, ask them to draw the blood and write this down, family, for something called the quantiferin. Quantiferin, Quantiferon, the quantiferin blood test. And it's 4 little tubes. I did 6 of them today, 4 little tubes, and we send that, and it's more specific than trying to look at somebody's arm who may not come back 2 or 3 days later. So if you don't take anything away from my discussion this evening, everybody on here should not only themselves get tested for TB, even if you're not coughing at all, yourselves get tested for TB, and 10 people in your village. Because I'll tell you, the rapid rate of tuberculosis is increasing to the point that after so many years of having it in your body, 50% of the people, up to 60% of people, it would just go away. It won't cause any problems. But if you are what we call immunocompromised, well, guess what now immunocompromised is? Having diabetes, having high blood pressure. Now we know HIV immunocompromised, and they said of all the cases of HIV positive infected individuals, TB is one of the most common killer of that population. Now, we don't even think about that. It's like, well, they died of HIV. Well, HIV was setting the stage, but TB killed the patient because you don't have a fight back. You've been exposed, and your body just succumbs to the tuberculosis bacteria. So get tested. It's on the rise. Millions of people die every year. Now, we see it in more South Asian countries and some African countries, but guess what's happening in some Caribbean countries? We got immigrants. We got immigrants.
Right,
And
right.
they're close proximity, and we love on them, but they're coughing. They've been exposed, and we can't even know, we don't even know their status, or health status in general, let alone what they're spreading. So New York, DC, Atlanta, all the different, but no matter who, what, if you're working in a nursing home, if you're working in a medical facility, or you just being around on the subway, get tested for tuberculosis. So there's treatment. You don't have to die from it. People are dying from it because number one, lack of access to care, lack of testing, lack of good health, lack of awareness. So I will take a few questions. And like I said, I've seen TB in my 40 some years of practice years ago when we had elderly people in the hospitals, and it is a debilitating. So you get a fever. Some people say, well, what is it? What are the symptoms? It's like a flu, but it just won't go away.
Okay,
And
because that was going to be my question to you. I mean, with so many different things going on, allergies and pollen and RV and COVID,
right, right.
and you
They
catch a cough or something
they
like.
call it the silent killer because you don't really feel too bad, but you're coughing. Because where is it? It goes first to your lungs, but then it loves going to your brain. It goes to your bones. It doesn't just sit there and stay in the lungs. It begins to spread latent TB. So it may be 6 years later, maybe 10 years later. But if you get tested for it, then you then know, okay, let's get the treatment started. Let's get monitored. Let's get the chest x-ray every 5 years, et cetera, et cetera. So everybody call your doctors and say, you know what, did I get tested for TB? They may say, oh, no, you're not a college student because here in the DMV, every year we have to test for TB. But then once you're 18 years old, you get a job, whatever, and you're not getting tested because we in the medical field are not thinking about it firsthand until
Mm,
someone is dying or if you're pregnant and TB spreads to the pregnant baby. So there are things if we just get tested. Otherwise, we just don't know.
wow, Angie B said working with the elderly and with elderly facilities, I've learned this. Wow. She said TB testing is definitely important.
Right.
Uh, Lynn says she works with TB people, tuberculosis, and then she said also, what is this the L what is that LTBIs or something? I don't know what that is. Lynn, what is that? You know what that is? Cause when she said,
The sick, were they looking sickly? I'm not sure what she's talking about in terms of the
yeah,
symptoms.
yeah, I don't know what that is either. So I mean,
Okay.
it's
Well, the main thing is the cough, which of course you said that, but you get night sweats. The fever is mainly at night. You're very, very tired and fatigued. You lost your appetite. You're coughing up phlegm. Now I'm gonna tell y'all how old I really am. And I say years ago we would collect the sputum. I guess we had on masks. I'm trying, but
mhm.
we would have them cough up in a container. Sputum is spit, y'all. We
Yeah,
collect it, and then we send it to the lab, and they can see the bacteria, the TB bacteria in the spit. There are times when we would have to do a lung aspiration, which is going deeper into the lung and pull up some tissues.
hmm
But the night sweat, we always say coughing up blood and having night sweats and losing weight. All right, and loss of appetite. Now I've seen TB um, abscesses. We had a kid that came from, I think he came from Africa, and he had a big mass, and it turns out we biopsied, it was TB. So,
really.
yes, yes, yes. So, and that's why, sadly enough, if you have AIDS, not just HIV, if you have AIDS, many of those symptoms will say, oh, they just died of AIDS. But often they have TB, they've been exposed, and they have active TB. So the exposure is first, then you have your latent, and then after that, you have your active disease. So we don't want to hear, and like your guests have said, I mean, that your audience have said, they see TB is still around and it can be fatal.
But why has it been so quiet? It hasn't been like a conversation. That's the
Okay.
key, right? Yeah.
Okay. Well, now, right. Exactly. Well, it's always been a social economical thing where poor people, people that don't matter, who can't get to the doctors, overcrowded shelter. But now it's spreading over to the the not so poor, and then we
Mm,
beginning to see it, unfortunately. So, and it can spread to the kidneys, the spine, the brain, and then you'll see it, and you see it in your lungs. And so I even tell folks, when you travel, we all love to travel. Be careful. Get I always have folks do a TB test before they go and a month after they come back,
because
because if they've been exposed.
that was required in school, right? Like for a long time, right? Like
Well, it's required in school up to 12th grade, and now it's required in the colleges. And a lot of the colleges want two skin TB tests. They don't, because it's
mm,
close proximity. Just like they'll get meningitis because everybody close, and 10 people in the dorm room and whatever, sharing all kind of body fluids. But meantime, close proximity. So the TB test is required for colleges. But everybody's over 22 years old. You finish
yes.
college at 22. So what happens to the next 60 years?
Mm. So now you're gonna have people every time somebody coughing, they're gonna be like,
I
uh
know. Oh no. Your aunt, my mother,
yeah.
she's practiced as a nurse for a while. And if she's on the elevator and somebody called, she frowned at them, she's like this. I'm like, Mom, she's like, they might have TB. Well,
Yeah.
well, she's
And
right.
that was the running joke. When people used to talk about like herpes or some shit. It was just like always that joke, like, "Yo, you got TB."
That's right.
People didn't even probably know what TB was, but they just said
That's
you.
right. That's right. And they be laughing, they be laughing. Well, it's no
Yeah,
laughing matter.
yeah,
It's
no.
no laughing matter.
I think you covered some things, but Deb, what's up, Deb? She said, besides coughing, are there any other symptoms that are pronounced that stand out?
Well, it affects your lungs right away, Deb. And so that bacteria. So what happens when it goes in? Let's say you took 100 people and exposed them to TB, and they end up, when they first get the exposure, there's something called macrophages, which is the big word for these cells. I call them the cleanup cells. They're in
Mhm.
your immune system, and they go, and it's almost like Pac-Man. Remember the little game?
Yeah, yeah,
And
yeah, yeah. Yep. Everybody, just Real Talk Chronicles. Doctor. This is real talk. Oh, there she is. We got it back. This is real talk with Dr. Marilyn Corder, and we're talking about tuberculosis, um, TB as it's known uh, in layman terms. Can you hear us, Doc? We're waiting for you to come back. I hope everybody's having a wonderful day. I don't know if it's your thing to see the eclipse and all that. It just got a little cloudy. I thought it was going to rain. I was mad because I was washing the car. I can't hear you, Doc. I can't hear you. Can't hear you yet. Everybody, this is Real Talk with Dr. Marilyn Corder. We come to you every second Monday of the month, trying to give you the best insight and information that we can possibly get. I switched up Real Talk until we get the doctor's volume back. We switched it up on certain things and what we try to bring to you. We trying to set up a whole Monday's Doctor's Corner thing. Like every Monday, we're going to have a doctor on talking about something. Thank you, Angie. Appreciate you chiming in, listening. Let me see if we can get the doc back. Let's see. Hold on.
Can,
There,
can you hear me
we
now?
got you. We got you. Yeah, it's all good. It's
I
all
just
good.
want. Okay, so the macrophages, those are the special cells that it's like the vacuum. They clean up. But then some people's immune system, they don't have those, what we call those cells, those T cells, the cells that beat up the bacteria, as well as viruses. So somebody asked, other than the lungs. So what it starts in the lungs. So you're coughing, you're irritated, then you don't have an appetite. But the night sweats, circle night sweats, circle spitting, coughing up blood.
Mm,
Those are that we used to think we called it the triad in medical school here at Howard. It was it don't well, we often would see where the compromise was, be it an elderly person, a dehydrated person, you know, a sickly person. But the thing was coughing, night sweats. We asked the relative, are they sweating at night? They go in and the sheets are wet, and coughing up blood.
mm-hmm,
Now, long-term TB, because often it's missed, and that's the problem. Not only exposure is missed, active TB is missed. That's the last thing these doctors are thinking about. But you should
mm-hmm.
have that right in the front of your mind, like we had COVID in the front of our mind. And so you're losing weight, you're failing to thrive, you're weak, you have the fever again. And so that's it. But so many things, you get those same symptoms. But TB will not just stay in your lungs, it goes to your brain. It goes to your skin. It goes to your kidneys. I've seen TB of the kidneys. I've seen TB of the brain. We worked at DC General, which was a city hospital, and
Mm-hmm.
we had a TB. We had a TB ward. You know,
Wow.
so I don't want to doom and gloom, but I just want to make you aware.
No, you did.
Everybody,
You wanted to doom and gloom us on the solar eclipse because let me tell you something. You got everybody
okay,
now. Next time somebody cough,
I
and
know,
like I said, now it goes on the sheet on the checklist. If somebody cough, it ain't.
right,
It's not just now. It's TB added to. Did you have COVID? Did you get RV? Do you
right,
got anything else?
right,
What kind of
right.
germs you got? And then we're gonna go old school. Wait a minute. What do you
Chest
got? Period.
X-ray,
You got a
right,
cold?
right.
Anything? Because go
And
ahead.
you
Go.
and you need to get a chest X-ray. Some people say, "Well, my insurance don't pay for it." Well, you tell the doctor to write it correctly. And let's just say they draw your
Mhm.
blood, but you've been coughing. It may not be pneumonia, even though there's something called TB pneumonia. And they aspirate the bacteria and they see where it's TB. We used to look at it under the microscope. So
Mm,
everybody be aware in the next 2 or 3 weeks, the next time I'm on, which is 4 weeks from now, I want
yeah.
everyone to have had a TB skin test or the blood draw. Have your
Wow.
doctor just write it. Even if it's not time for your physical, you let them know you heard about the TB uptick and you want not, and it is not just in different undeveloped countries. It's here. And they blame it on migrants, but they blame it. We also travel. When COVID opened up, we've been traveling our butts off. And when you go to different places and had a good time and partying and all that, and just, chumming up with everybody, those are countries that um, are high in TB.
Yeah, Angie said she just did hers. Yeah.
Good. Good. Angie Smart. Okay. And share that information because again, it's been on the back burner. We don't talk about it, but it can kill you. It's called the silent killer.
And Angie said it's been here And then Lynn said also, what did Lynn say? Lynn said it's free at all city hospitals. Wow.
Wow. See that? See that?
On, who knew?
Hmm.
I'm glad you're bringing this to light because, when you said to me, you was like, yo, you told me, Malika, and he's like, I got something I want to talk about today. You know,
Right.
that's important because, like you said, it's an uptick and it's here. And unbeknown to a lot of people, nobody's thinking of TB anymore.
Right.
It's not even a joke anymore. Like people don't even joke this up. You'll be looking like you'll say
Right.
COVID, you'll say anything else, but
Right.
you won't use that joke and say, oh, yo, what you got TB? Because who's heard of TB in so long? Like TB is like almost a forgotten illness.
It's almost like polio. Like what? We don't have that anymore. Oh yes, you do. And you need antibiotics. And most people, when they start, please, if you are and been exposed, because a lot of people who are healthy, they've been exposed, and they're like, oh my God, that doesn't mean you have it. Get your chest X-ray. But when the doctor writes that prescription, 90 days times three, which is 4 to 6 months, you have got to stay on the medicine religiously every day, and then every 5 years, getting your chest X-ray done. And if there's a cough going on, and it's more of a dry cough. It's not an asthma cough, but it's a dry cough, but it doesn't go away. You're not going to take NyQuil, Dayquil, whatever. It just doesn't go away. So get tested, and usually it begins to overwhelm your body. Your chest hurts. Again, you're fatigued. You're weight. You're losing weight, and you're just beginning to look sickly. Pregnant. So
Wow.
so there are conditions. Of course, the literature is going to say HIV. Okay, I get that. But again, autoimmune conditions, again, even some asthma, but if you're pregnant, you're more compromised. Diabetes, we're more compromised. So we have to make sure before you get TB of the brain and TB of the lungs and TB of the bones, get tested. So that's simple. And when you're traveling, again, please make a note. Take a TB test before you travel, and then take a
Wow.
TB test a month or two. And that's what I've been doing in my practice for years. I've picked up some. And then if you were born in certain places of Africa, you get a shot at birth called a BCG. B as in boy, C as in cat, G as in go. And that BCG is a vaccine, a shot that protects you from TB. So those countries that saw a lot of TB, part of their newborn screening or newborn testing in the hospital, they gave you a BCG. So I have patients from Africa who got the BCG, and their skin test is going to come up positive because they got that shot. So I have to do their chest X-rays every 5 years.
Mm.
Okay. So the colleges are freaking out, and we look back and we say they got a BCG at birth. So there's a special protocol for that.
Wow. Um, Lynn said, yes, it's an uptick and it's spreading faster than COVID. Uh,
Thank you, Lynn. And we don't talk about it. It's not fancy. It's not a sexy thing to talk about. There's no vaccine for it. It's treatment that's old school antibiotics. They're talking about a new treatment that's coming up that's not so mundane and drawn out and months, that people will start hopefully take a shorter course. But right now, anybody who's on TB medicine, please, for their sake and the community's sake, stay on the medicine. Complete the medicine. And again, they're going to always be skin test positive and quantiferin positive, but that does not mean that they have active TB. The medication that you're giving them, as we giving them, write them all the time, the prescriptions, as we giving that to them, will stop the spread of TB.
uh, Barbara Jean has a question for you, Doc. She says, does having hot flashes and sweating at night something to think about when it comes to TB, or is it just menopause symptoms?
I know. See, and see, that's why I said it's the great masquerader. I didn't say that, but it's the silent killer. Baby, if you have not if you don't have a weakened immune system, and number two, if you're at the point of night of menopause, more likely it's menopause. However, go get a test. And the TB bacterium is called Mycobacterium tuberculosis. But go get a test. And they're saying over 3 million people globally have TB. That's nothing to
Wow.
joke about. Okay. And like I
Wow.
said, it used to be called consumption. And consumption, it's in the word. It takes over your body. And now they're saying worldwide, it still kills millions. I called my son and my daughter. One lives in Asia, and the other
Yeah.
one lives in Ghana, and I'm
Ghana,
like,
yeah,
look,
yeah.
look, Negroes, when y'all come back home, Adrian's on the flight here now, and
Okay.
her brother will be here in a month. I'm gonna be doing skin tests and blood tests, and say
You gonna-
you ain't coughing on me. Put that mask on before you come up in my face.
you're gonna be pricking and plucking like as soon as they kick.
Okay, give me that vein. That's right. That's right.
That's it. Lynn said that's only for the latent TB. I
Right.
guess, like you said, there's
Right.
more. I guess there's
That's
different
right.
levels.
So Lynn is because the primary TB, you don't have symptoms. And see,
Mhm.
that's the scary thing. You don't have symptoms. The latent TB is where the germs are in your body to the point that it's spreading to the different parts of your body because your body has lost the fight. And so latent and active TB, you see that. But again, you can see TB in different parts of your body, which is the weirdest. It's like it takes no prisoners, and it will and can go anywhere outside of the lungs. And we call it the extrapulmonary TB. And it can spread. And again, a cough that lasts more than 4 weeks. Now, you may have an allergy cough, but it's a dry cough. It's chest pain, coughing up blood. We learned that coughing up blood, feeling tired all the time, night sweats, fever, loss of appetite, and we see TB in children and teenagers, and some of the kids who are homeless and foster homes, etc. But we also have international children whose grandma has TB, and they working with the grandma, and turns out they actively, they contracted it, and we do a test, and we're like, wow, and we have to test the entire family.
Wow, that's crazy. So a lot of times, basically, you know, somebody, and that's how you catch it. Somebody just coughing, and then next thing you know, you were like, oh, I got this shit now. You know what I mean? Like, you know.
So okay, so here, like it reminds me of HIV years ago. Oh, you can't be in the same room. So you're not gonna get TB from shaking hands. You're not gonna get TB from using somebody's towel. Now, don't use nobody's toothbrush. You're not gonna get TB from sitting on the toilet behind somebody. However, these are your risk factors. If a friend, a coworker, or family member has active TB, now we spend more time with coworkers than your loved ones often, right?
Yes. Yeah.
Okay. Number two, you live in or have traveled to an area where TB is common. So when you go to these exotic places, just understand what's going on. Because I'm about to talk about dengue fever, which is big time in Puerto Rico, but it's in all
Mm.
the Haitians. And so that's big time. We're seeing that a lot now. So TB is common, like Russia, Africa, Asia, Latin America, and where else? The Caribbean.
Right.
Those
Right.
are the places. So that's risk factors. Number three, you're part of a group in which TB is more likely to spread, or you work or live with someone who is part of a group. In other words, this includes people who are unhoused, so working in a homeless shelter, people with HIV, those in jail or prison, and those who use injected drugs. And that means those people who can be around you and expose you. So just be aware of the status of those that you work with, as well as those that fit the category. Now, here's for some of your listeners. If you live or work, if you work or live in a hospital or nursing home, so the nursing home patients, but us as doctors, healthcare professionals, we're more at risk. And then the next thing, you're a healthcare worker for patients who have high risk TB, or if you're a smoker. So these are what the CDC is listing as high risk. Now, then they say you have higher risk if you have HIV or AIDS, if you have serious kidney disease, if you have head or neck cancer, if you have diabetes. Now, listen, us black folks, if you got diabetes, okay, or on chemotherapy, or have had an organ transplant. I don't know what
Mm.
to say.
Wow. So Lynn says, I guess it was pertaining to something that you had said. She says, for TB, you must be observed taking your meds.
Yes, yes. It's called swallow. See, yeah, well, yes. And anybody who cares about you, who lives with you, it's more important that you get observed taking your meds more than somebody on birth control pills.
Mm.
I mean, we're getting non-compliance with my teenagers, but if somebody, and I tell the parents, if I'm writing for isoniazid or rifampin for TB, I tell the parents it's important because the pills ain't little either. It's important that you sit there and watch Johnny take his medicine.
Wow. And then she says, or you will be detained for the remainder of your treatment by the the DOH or the
Yeah,
CDC.
yeah, right, with CDC. And but see, we're getting away from that. And unfortunately, people don't have the staff to do that anymore, etc. But we could do now. We do CT scans. Usually, it was old fashioned a chest X-ray, but we're getting very sophisticated. And then I'm just looking through my notes. So you could have a false positive meaning that, oh, it comes up positive, but then you get to questioning the people and find out they were born in Africa, and they got a shot at birth, but you still have to do the 6 to 9 months treatment, and that's the antibiotics, and
Yeah.
take it and take it and take it.
Andre says, he says, what docs takes on natural herbs like Marilyn tea that helps with the lung issues? I find that this is helpful for my patients with lung and respiratory issues.
Yeah, so there's a lot of anti-inflammatory. Of course, watch what you eat. Don't do a lot of processed and don't do a lot of foods that cause mucus. But if you pull up on even on the internet and say what helps strengthen your immune system, what helps lung function, I already said stop smoking, don't do this, don't do that. But there are foods and there are supplements that will help. I love vitamin C. I love vitamin B. I love vitamin D. Vitamin D is also, I call it the total vitamin. But because TB can cause everything from joint damage to lung damage, infection, again, your lymph nodes, your bones, the spinal. And we know we had a kid also that had it in his lymph node. He had such a big gland, and we tested it, and it had TB bacteria in it. And it also can cause cause heart attack because it's inflammatory, and it inflames the tissues around your heart. So there it is. So can it kill? Yes. Does it kill millions of people? At least 1.5 million people per year globally? Yes, it does. And we here in the United States think we're above. Oh, we don't have TB here. Yes, we do.
Wow. I mean, I'm sure you might have addressed this, but what's the cure? I mean, is it the meds over the course of time, like 6 months? I think, like you and Lynn were talking about, or something like that.
So the first part of the cure is access to testing, because you can't cure it unless if you don't know it.
Right, right,
So
right.
lack of knowledge will kill you. All
Understood.
right. So
Understood.
you want to first, step one, get tested. Step two, if you're positive for TB, where is that positive? Is it early exposure? The treatment is going to be 4 to 6 months. Some years ago it was a whole year, 12 months, but 4 to 6 months of antibiotic. Rifampin, isoniazid. Now, some of the antibiotics give side effects. So don't take it on an empty stomach. There are a few things, you may get a little yeast. Yeah, yeah, you're not going to die from yeast though. And you might have some, I don't know, lack of appetite a little bit because your antibiotics will do that. But the main thing, the cure is there is a cure, but don't wait till you have latent TB. Then you up a creek. It's
Oh,
just it's just comfort care after that point.
wow. Okay.
So let me give you this. 2021. Now I saw something as late as 2023, but in 2021, are you ready for the numbers?
Let's
More
talk.
than 10.5 million, more than 10.5 million were infected with the disease. Now pay attention to what I'm saying. That's not, you could times 10 that of exposure, but
Wow.
we're talking infected with the disease. Okay. And of course, they're talking about Western Pacific, Africa, Southeast Asia. But how many people y'all know going to different places, including Bali, going to Africa?
A lot of people.
Okay. Going,
A lot of people.
exactly.
That's like the thing to do now. Going to Dubai, Bali,
Right. Right.
places. Yeah,
That's,
that's good. Yeah,
yes. That's it. Okay. Keep on. Okay. Across
yeah.
the world, nearly 9 out of 10 cases of TB and almost half of cases of drug resistant TB, they are eventually cured. However, treatment can last several months. You might feel better in a few weeks, but you got to stay on your medicine. One thing about grown-ups, when they feel better, they forget that they're taking medicine.
Yeah, they stopped taking it. Yeah.
They stop taking it. And it can spread through droplets in the air that you breathe. Most people who are exposed to TB are able to fight off the bacteria and keep it from becoming active. Now, let's talk about these places that people go. What's that place, and you're vaping and you're passing this and you're passing that?
Oh, the hookahs and all kind
The
of stuff.
hookah, yeah, yeah. Come on, think about that. Bad enough
Yeah,
what it does to your lungs, but what if somebody got TB? Because they've
yeah,
been at somebody else's house and somebody else, and it was spread, and no one's getting tested.
yeah. That's crazy. Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder. This is Real Talk with Dr. Corder. We are talking about TB, tuberculosis, for those that don't know the full name of it. And the doctor has explained how you can get it, what you should do in testing for it, and procedures going forward. So the bottom line is, she is saying it's the uptick right now with with TB,
Mhm.
and you need to get tested. What are you saying, Doc? Like when you go get your annual checkup, ask your primary to.
Don't
Uh,
even wait for the annual. I'm going to read three more quick things. So it may sound like TB, it may sound like a disease of the past. We always said that, but TB, tuberculosis or TB, is still a real concern today. And as the old saying goes, an ounce of prevention is worth a pound of cure. Well, an ounce of prevention will save your life. And those are my words. In other words, the best way to be well is to avoid getting sick in the first place. So the prevention. How does it spread? We know how it spreads through the air, through the air. Not to mention somebody sharing body parts, body fluids. And it's
mhm.
active means the TB is multiplying in your body. So you could be exposed, but it may not be active. Hopefully, your immune system, the macrophages, are eating it up and getting it. But if you have active TB, and that's why the doctors advise those who have active TB to stay home, keep on your medicine, stay away from people as much as possible until they no longer have infection. So you have to keep going back to the doctors to make sure. And that's 6 to 12 months. We talked about that. You take all your medicine the entire time, even if you feel better, and they emphasize that is if not, you can get sick again, and TB can overcome you. And latent TB, as one of your guests said, that's when it's in your system and you are fighting it, and you still have the active germ, and it's a battle. And unfortunately, if you're not doing what you're supposed to do and eating good, someone asked about vitamins and supplements, you always need to bounce back with that. Always cover your mouth with a tissue when you cough or sneeze. I'm thinking about my mother on the elevator. Seal the tissue in a
Yeah,
plastic
yeah.
bag, throw it away. Wash your hands after coughing. Even hand, I say handshaking, maybe, because if somebody could have just sneezed in their hand and dried up, and you shaking a hand, then you got it in your face.
Mm.
And somebody who's coughing, don't invite them to your house and don't visit them. Just wish them well with a card.
Text me, text me or call me, right?
Right, exactly. And wish them well. And hopefully they will be a success story.
Wow. So the process of healing, getting rid of tuberculosis is maybe up to 6 months or something. Maybe could be, huh?
Yes. And you have to be followed. So us providers, we have to see you. When I say us, we have to make sure that you're fine. But if you're not coming in, we can't help you. It's
Wow.
not like no news is good news. No news can kill you. No testing can kill you.
Yeah, and shame on us that we want to pre-medicate ourselves. You know what I'm saying? We want to take care. We want to diagnose ourselves and take care of it. Um, I was talking to a close family friend recently, and I was telling her, I was teasing her about if anything happens, she will go get herself tested in a minute. But who knew that might be the thing to do? Everybody, this is Real Talk Chronicles with Dr. Marilyn Corder. I'm your host, Bill Forster, with Dr. Corder. It's her show, and we're talking about TB tonight. Something that it's an uptick right now with what's going on in the world today. So she is suggesting that you all get tested, um, not just when you get to see, not your annual testing, but just get testing, period. And um, who knew? With so many different things that's happening in the world today, uh, the doc has just informed us that TB is right there on that chart. It's not in it might be in your top 10. It ain't your favorite top 10 playlist, but it's in there to get that TB that testing. So doc, right now, where would you say TB is standing on that chart? Like Is it COVID still?
Hey, hey,
RV?
can you hear me?
Yeah, I got you. Go ahead. We just lost you. We get you back in a minute. Can you hear us? We'll get the doctor back in a minute. Uh, yeah, so everybody, you already know, Row House is the place to be. Come out Wednesday through Sunday. We have a good lineup of stuff that you can enjoy, and we're playing back and forth with the doc. Hopefully, we'll get the doc back in a few minutes. Doc, can you hear us?
I'm
Uh-oh, she'll be back, everybody. We'll get her back. Got a few more minutes. Oh, whoa, excuse me. A little tired, no TB. So, please, if you like the content, share it. Let people know that this conversation was about TB. You know what's happening in Real Talk. We're here Mondays and Wednesdays. Hopefully Wednesday we'll be here with our guys and see what's happening. Hold on for a sec. All right, everybody. Doc is having some technical difficulty, but I have her on the line, so
Yeah,
she can still hear you. Yeah.
When I get a call, that was my daughter calling me. She must have just landed in Dallas. So the point I'm saying at this point, even though don't wait for your annual, get your TB update, get your test, and make sure you understand what it means. Talk to the doctor. I prefer the blood draw. Now the skin TB test, it all depends on who's doing the test. Sometimes they don't put it correctly under the skin because some folks are just not that experienced. But go ahead and get your blood drawn. It's called a quantiferin gold. Go to LabCorp, call your doctor, say write an order, get your TB test, and just say somebody coughed on me. Okay.
Yeah.
I heard a report. Okay, I'm coughing. And if it's positive, then they're gonna do a chest X-ray and they're gonna give you some medication, and then you can save other people by sharing the message that I gave today. Please do so. That's what this is all about. This is why I take the time for my cousin's show to just share. And so often we don't hear this. When I was on the other day, I was on Newsy and whatever the other two stations. And, I'm telling folks, but those are stations that sometimes we don't listen to or we don't hear about. So that's why I said I must talk about tuberculosis.
Yeah.
And I also want you all to know dengue fever, DENGUE, it's an epidemic. It's a medical emergency in Puerto Rico, but it's everywhere, even here. So you have to know the symptoms of that. Just pull that up. I'm not going to do a whole conversation because I got 3 minutes left.
Yeah, exactly. Absolutely.
But just be aware of travel and just be aware of your own health. And please don't ignore TB. Please get tested for that. We talk about know your numbers, blood pressure, hemoglobin A1C, cholesterol, all of that, but also know your TB status.
So let me ask you a question before we let you get out of here. Two things. Tell us where TB is ranking right now in the point of severity and things that on. I know you talked about the uptick, but okay, what's right now still at the top of the chart? Is it like COVID still, RV, or like is TB next, or is like TB has jumped the loop?
Okay.
Yeah.
Okay. The number of U.S. tuberculosis cases, here we go, in 2023 were the highest that has ever been in a whole decade. 40 states report an increase in TB. 40. And the rates were up among all age groups, including infants. Mm-hmm. The CDC, more than 9,600 cases were reported. But this is, guess what? This is nothing compared to people just not getting tested. So when you hear that, and I tell everybody as I teach my medical students, this is really a pandemic. And they doctors who treat tuberculosis patients blame the pandemic for the rise in cases since we don't have enough access to medical care, and we can prevent that. So it's in 40 states. So what does that mean? It's everywhere. We're not just talking the Caribbean and Africa. It's everywhere. And we are seeing it. And it rose and it's continuing to rise. And those are the ones that are testing. But more people are not testing who have TB.
Wow, this is some stuff. TB is no
Yep,
joke. It really is. You
that's right.
know. So, Doc, before we get out of here, give us some positive affirmation, and then who do you got winning the game tonight? Purdue or UConn?
Well, you know what? It's interesting. I like both. I don't know. I'm going to say UConn.
Okay.
You know, the girls
Okay.
didn't make it, so I'll say UConn.
All right.
But, you know, the game is over. From yesterday, I'm done.
Yeah.
I'm not going to have any palpitations.
Yesterday was an exciting game, too.
It was.
An exciting game.
Oh, my God.
Like, shout out to South Carolina, Dawn Staley. She did her thing. Right. I know Malika, we was watching it. Malika was like, Philly, Philly, Philly. Is that how you say it, sweetie? I don't know where she went. That's right. Exactly. And just give us some positive love before we get. Oh, you know what? Tell AC if come here for a minute. And, tell AC if she wants to come on next week or something. Want to talk about Ghana and what's going on in Ghana. She can come on Monday. You know. Okay,
I will let her know. And look, Steve Harvey was doing a Ghana Family Feud. I was looking at that. That was hilarious.
Really? Hilarious. Oh my goodness.
Yes, and yes.
Hold on, Malika. Malika want to come and say her little Philly thing. Come on, for Dawn Staley. Say
Philly.
Yeah. That's their thing. So everybody.
That's right.
North Philly zone. That's where I'm from.
That's it. That's where they're from. So on behalf of Dr. Marilyn Corder, I am Bill Forster. That is Malika Forster. We will see you later on this week. Thank you, Doctor. Go pick up cuz. Have a safe travels. Be careful. Love you guys.
Thank you.
Talk to you in a minute.
All right. Take care.
Love you. Right. Bye-bye.
Be good. Bye-bye.
Bye-bye.
Everybody, that was Dr. Marilyn Corder. She was calling in because she got kicked off.
Great information.
Yeah, it's something funny. Who knew about TB like that, right?
Didn't know. They're not talking about it at all.
You gotta be careful, people out there coughing and shit.
Yeah.
Get out my face. You know what I'm saying? Yeah. See? Give it back. Let me stop. You know what I'm saying? Thank you all. I appreciate it. Share the information. You need to talk to me. Oh, wait, hold on. Let me see what Lynn says. Lynn says, you need to talk to me. I can go get you somebody from the to talk more about the what is it? To elaborate on TB, especially in Harlem. Okay, Lynn. We'll sidebar. Let's talk tomorrow. And we can get them on the show. I have no problems with that. And as long as it's positive information and health stuff, I got it. Then, holla at your boy. Yeah, exactly, Angie. Sharon is Karen. Everybody, hey, Dana, what's up, niece? I see you right now chiming in. So everybody, appreciate you. Share the information. We're going to get out of here. I don't know if y'all was all hyped about the solar eclipse thing. It got a little dark. I was almost about to get mad. I forgot about the solar eclipse. I thought it was going to rain. And then I realized it was about the solar. So it was cool. It just looked like it was raining where we are, And, next thing you know, the sun came back out and I was like, okay, I'm good. So I don't know if any of you all have witnessed the solar eclipse. If you did, fancy dancy for you. Otherwise than that, I don't
saw that Aaliyah of Make My Cake. She went to Montreal to watch it. I just saw that on Facebook. Yeah, I thought that was pretty cool.
She need to be making cakes. She was traveling around and shit, playing games. Wait till Aaliyah's our cousin, so we're gonna talk about that. Yes. We're gonna see what's going on. Yeah. Stop playing them games. Did you want to see the eclipse today? I'll be honest.
Yeah, I actually was in a meeting and it was funny because I always keep the windows open, and as I'm talking, I could just see it getting darker and darker.
Did you get scared?
I know.
Okay.
I'm well protected.
Yes, that's true. That's true. Real talk.
No, but it was interesting. Interesting moment. I saw some of the news stories. So
yeah, exactly.
So we can see it again in 45 years, I think. 44, 45.
God willing, right? Yeah, God willing, exactly. We'll Dana said, "What's up?" She said, "Hey, Malika."
Hi, Dana.
Yeah. So everybody, right now, I don't know what I'm about to do. I know I got some stuff to do.
They're going to watch the game.
Yeah, but I know I threw a bunch of clothes. I was looking for some,
See, I wasn't going to put you on blast like
so
that.
Blasted.
You got some housework to do, right?
Yeah, exactly. So, everybody, it was great chopping it up with you. Thank you.
I'm so tall.
Yep. And we appreciate Norm. What's going on, brother? How you feeling, man?
Hi, Norm.
So please look at the content, subscribe to it, share it, do what you do. Positive is a beautiful thing. Positive messaging. Hopefully we'll be here Wednesday. and we can chop it up with you. You know, as Stefania affectionately calls us, the cop crew, and we can chop it up. And listen, real talk. See you later. Say bye.
Bye.
Bye. All right, everybody. Talk to you later.
See ya.